Here is a detailed explanation of infertility, covering its pathophysiology, step-by-step process, treatment, and prevention in depth. Infertility. Introduction. Infertility is the inability to achieve pregnancy after 12 months or more of regular, unprotected sexual intercourse. It affects both men and women and can result from a variety of physiological, hormonal, anatomical, and environmental factors. Infertility is classified into primary infertility, never having conceived; secondary infertility, difficulty conceiving after having previously conceived; pathophysiology, step-by-step process, a female infertility. 1. Hypothalamic dysfunction, central cause. The hypothalamus secretes gonadotropin-releasing hormone, GnRH. Stress, eating disorders, or low body fat can suppress GnRH secretion. GnRH, FSH, and LH, impaired follicular development and ovulation failure. 2. Pituitary dysfunction. The pituitary gland produces FSH and LH under the control of GnRH. Conditions like pituitary adenomas, hyperprolactinemia, or Sheehan syndrome interfere with this. FSH, LH, anovulation, or irregular menstrual cycles. 3. Ovarian dysfunction. Polycystic ovary syndrome, PCOS. Excess androgen production and insulin resistance cause anovulation. Premature ovarian insufficiency, POI. Ovarian reserve depletion before age 40. No mature follicle equals no ovulation equals infertility. 4. Tubal factors. Pelvic inflammatory disease, PID, endometriosis, or past surgeries can cause tubal scarring or blockage. Fertilization cannot occur because sperm and egg can't meet. 5. Uterine abnormalities. Fibroids, polyps, congenital malformations, e.g. septate uterus, or Asherman syndrome interfere with implantation. 6. Cervical factors. Abnormal cervical mucus production, too thick or hostile pH, impedes sperm motility or survival. B. Male infertility. 1. Hypothalamic pituitary axis dysfunction, GnRH, FSH, and LH, stimulation of Sertoli sperm production and Leydig cells, testosterone production. 2. Testicular failure, varicocele, abnormal dilation of veins in the scrotum impairs thermoregulation. Infections, e.g. mumps or orchitis, trauma, radiation, or undescended testes cause impaired spermatogenesis. May result in oligospermia, low count, asthenozoospermia or teratozoospermia, abnormal shape. HAT 3. Obstruction of the reproductive tract. Blockage in epididymis, vas deferens, or ejaculatory duct prevents sperm transport. HABA 4. Ejaculatory or erectile disorders. Conditions like retrograde ejaculation, erectile dysfunction, or neurological disorders can impair semen delivery. HANA 5. Genetic and chromosomal abnormalities. Klinefelter syndrome XXY, Y chromosome microdeletions, CFTR gene mutations in congenital bilateral absence of vas deferens CVD. Treatment of infertility. Treatment depends on the underlying cause, duration of infertility, and age of the partners. A. Female infertility treatment. 1. Ovulation induction, used for anovulation or irregular cycles. Clomiphene citrate, Clomid, stimulates FSH-LH by blocking estrogen receptors in hypothalamus. Letrozole, Femara, aromatase inhibitor that lowers estrogen and increases FSH release. Gonadotropins, FSH, HMG, HCG, direct ovarian stimulation, used when oral agents fail. 2. Hormonal therapy, thyroid dysfunction correction, levothyroxine, or antithyroid meds. Dopamine agonists, e.g. bromocriptine, cabergoline, for hyperprolactinemia. Metformin to improve insulin resistance in PCOS. 3. Surgical interventions. Laparoscopy to remove endometriotic lesions, lysis of adhesions, or tuboplasty. Hysteroscopy to remove intrauterine fibroids, polyps, or septa. 4. Assisted reproductive technologies, AART, IUI, intrauterine insemination, washed sperm introduced into uterus during ovulation. IVF, in vitro fertilization. Eggs and sperm fertilized outside the body, embryo transferred to uterus, ICSI, intracytoplasmic sperm injection, a single sperm injected into the egg used in severe male infertility. B. Male infertility treatment. 1. Hormonal therapy, for hypogonadotropic hypogonadism, HCG plus FSH injections. Avoid testosterone therapy as it suppresses sperm production. 2. Surgical management, varicocelectomy, removal of dilated veins to improve sperm parameters, vasovasostomy, vasectomy reversal. Sperm retrieval procedures, TEAS, Testicular sperm extraction, PESA, percutaneous epididymal sperm aspiration, for ART. 3. Lifestyle modifications. Avoid heat exposure, e.g. saunas, smoking, alcohol, anabolic steroids. Weight loss and exercise improve hormonal profiles. 4. Use of ART, especially for low sperm count or motility. ICSI is highly effective in male factor infertility. Prevention of infertility. General preventive measures for both sexes. Preventive measure description or motility. Sexually transmitted infections, STIs. Use condoms, early treatment of infections to prevent PID or orchitis. Healthy body weight, both obesity and underweight affect hormone levels and ovulation. Nutrition and exercise, balanced diet and regular activity help maintain reproductive health. Avoid toxins. Limit exposure to pesticides, radiation, heavy metals, and solvents. Avoid smoking and alcohol. Tobacco and alcohol lower sperm quality and disrupt female hormones. Manage stress. Chronic stress affects GnRH release and menstrual ejaculatory cycles. Avoid excessive heat exposure. Important in men, no tight underwear, hot baths, or laptops on the lap. Regular screening, especially for thyroid issues, PCOS, prolactin levels, semen analysis, etc. Family planning education. Early education about age-related fertility decline. Conclusion. Infertility is a multifactorial condition with a wide range of causes. A deep understanding of its pathophysiology enables targeted treatments. Early evaluation, lifestyle modifications, and appropriate medical or surgical interventions can improve fertility outcomes. Prevention plays a crucial role, particularly in protecting reproductive health from avoidable harm and infections. Thank you. Have a nice day.